Brain Chat. I'm Dr. Mitzi Joy Williams, your board-certified neurologist and fellowship-trained multiple sclerosis specialist. My mission is to engage, educate, and empower those impacted by chronic neurologic conditions to become an active part of their healthcare team. Here on Brain Chat, we'll be discussing all things brain health, wellness, self-advocacy, and how to care for your loved ones who are impacted by chronic neurologic conditions. Join me and my super friends and special guests as we get ready for the next episode. And most importantly, let's get nerdy. Hey, everybody. Welcome to Brain Chat. I am so excited to be here with you. And I have a very special guest and super friend with me tonight. And we are going to be talking about all things the gut. So I am, with no further ado, going to introduce Dr. Sansa Curtis. She is a naturopathic physician and she is a physician assistant who is certified in integrative medicine. She is the CEO and founder of 3D Wellness in Roswell, Georgia. So just say Atlanta, because nobody knows where, unless you live in Atlanta, you don't know where Roswell is, but in Atlanta, Georgia. And she founded this practice in 2011. And I cannot wait for us to have this great conversation talking about how you can get your gut healthy and how the gut affects autoimmune disease. Welcome, Dr. Sansa. How are you?
I am wonderful, and thank you for having me, Dr. Mitzi. I'm so excited that I have somebody to get nerdy with.
Yes. So we're super excited about this episode. I get a lot of questions about the gut, but before we get into that, let's take a couple steps back. Whenever I have a guest on Brain Chat, I always love for you to just tell us a little bit about yourself and how you got into your field of specialty. So how did you get into integrative medicine?
Ooh, well, it came full circle. My grandmother is an herbalist and a midwife. So we were detoxing before we knew what detoxing was all about.
Mm-hmm.
And
before it was a thing.
It was a thing, And if you're anywhere from down south, cod liver oil was a thing before, fish oil was a thing.
Absolutely.
So that's what I grew up with. And my dad was in the military. So, you didn't run to the hospital in the military because it was like, going to a third world place, wait there for 3 hours to get seen. So therefore, we grew up like my mom did, right? And I can just remember my grandmother when she finally got of age to get insurance, Medicare. She ended up having an autoimmune disorder. We didn't know what it was then, but she had thyroid eye disease and had no clue. And I can remember going to her closet and giving her a shoebox full of pills. Wow. And she graduated to 2. And that's when I decided there has to be a better way. So that's when I first became interested in medicine. And then I went to, life happened, I started school, and then I went back and became a PA. And after a while, I decided, I was tired of giving an ill for every pill. And I came full circle and went back to school to be a naturopathic physician. And it was like my aha moment, right? I was like, everything grandma was telling, my grandmother was telling me, there was true science behind it. So that was just really exciting. And then my daughters now have autoimmune disorders. So it was my daughter initially that prompted why I got into autoimmune, but I had went back to school to, again, I think I'm a long-term student, to go through the Institute of Functional Medicine, be certified through functional medicine.
Yeah, I love it. I always talk about the fact that in medical school and in much of our formal medical training, they don't teach you a lot about things like nutrition. They don't teach you a lot about exercise. They don't teach you a lot about the importance of sleep. You just kind of have these general things that you say to people like, you need to get some sleep. You need to eat good. You need to get some exercise and move. But really, we're in an era where I think those kind of blanket phrases are not good enough. We need to give people specific recommendations, and we need to direct them to places where they can get specific recommendations if we're unable to do that. So I've been really excited about, the rise of functional medicine and integrative medicine. thought about going back and doing a fellowship myself, but Dr. Mitzi is, I'm a lifelong learner, but I do not feel like getting another degree or another training. So I will leave it to you, wonderful experts who have the energy, and I will have you on my show so we can talk about it. All right. So, first, before we get into talking specifically about the gut, you talked a little bit about functional medicine and how you got interested in that. What is functional or integrative medicine? What does that mean? What does that term mean?
Functional medicine works on systems. So, like in conventional medicine, if you go to the cardiologist, he's only looking at your heart.
Right.
He's not looking at, they may look, a diet or here or there, but they're not looking at other things. So, functional medicine looks at or integrative, you integrate the whole person.
Yeah.
And you look at the whole person and you look at their systems. So it's almost like connecting the dots. Like, I look at the dots above your brain, And so, but remember when we were little kids, you had all the numbers on a piece of paper and then you had to connect the dots. And as you start to connect the dots, then you begin to see the big picture. Yeah. So that's the best way I can explain functional medicine is begin to take your history, your and what's going on around you and your genetics and just life and what has happened. And then you begin to formulate, okay, well, this is what's going on. This is where it started. And generally, I always tell patients, disease started from 0 to 10, but we don't see manifestation until it gets like 5, 6, and 7. But it's been brewing here.
Yeah.
But we'll say August the 1st, 2001, that's when I was diagnosed with X. So we come with that and we work on clearing up those systems with simple lifestyle modification and just helping clear emotional, mind, body, and spirit.
Yeah. Because all of these things are integrated. I spend a lot of time educating and counseling my patients about the mind-body connection. Some gurus say mind-body are one. It's not even two separate things, right? But all of these things are connected, and we cannot expect our bodies to work like they're supposed to if we have so much emotional trauma or things, of that nature going on. And we have to believe that those experiences affect our bodies, the things we take into our bodies, the type of things we eat, the exercise we do or don't get. It affects our bodies over time and can result in disease. So I often say I spend probably about 20 to 25% of my time talking about medications, and the rest of it is like, okay, are you getting sleep? What's going on? Are you stressed out? Do we need a therapist? What do we need to do? Do we need to go here? What are we eating, right? So we spend a lot of time talking about those things because ultimately, when we think about things like diet, exercise, etc., we think about cardiovascular health, but really those things help brain health, right? So brain healthy behaviors are healthy behaviors that actually science has shown keeps your brain from shrinking and keeps your brain resistant to injury. So these things are extremely important. So I digress. I could talk about brain health all day, which we're kind of going to talk about indirectly. But today we're talking about the gut. All right. Now, when we talk about the gut, I remember growing up, when we said somebody had a gut, we were talking about their body habitus. So a gut was like your muffin top, so it was like, oh my God, or somebody had a beer belly or a gut, right? We're obviously not talking about that, but we're talking about, tell the people, what is the gut? So when we talk about the gut and your gut is healthy or not healthy or what, we're not talking about your muffin top. What are we talking about?
We're really, when you talk about the whole gut, the whole digestive system, right? But, we talk gut, stomach, and small intestines, large intestines. But you forget that it starts from chewing the food, masticating the food. Because if you don't masticate your food, chew the food, then your stomach has to work overtime to try to break down the food. And then it dumps into the small intestines and now through the large intestine and through the anus. So that's your whole, digestive tract that we look at when it comes to functional medicine. And even it's interesting, we're talking about brain, but the gut is your second brain because of how the neurological system, when it gets to the gut, it has a bidirectional communication. So, and that is like fascinating now, as they're sequencing the gut microbiome, they can look at it and see what things changing DNA expression with different things, and just looking at even doing different medications based on your gut microbiome. There's a marker that we look for in blood work. It's called don't ask me what it means because I don't know, but TAMO.
Mm-hmm.
Okay, we always know these acronyms,
Of course.
but we can measure that, and that's a marker for gut and cardiovascular to see if your cardiovascular issues are gut related. So I'm just so excited about just how science is evolving,
Yeah.
and we're no longer, or we should no longer be practicing algorithm medicine, if A then B, because all diseases, like I'm pretty sure you know, are not all created equal. You got MS,
Absolutely.
this person can do this something, and this person can present and do something totally different. But in our medical books, we have one, algorithm and how to treat it.
Yeah, I tell people all the time, honey, you did not read the textbook before you came in. And so that's the majority of people don't read the textbook, right? Because everybody is different. The way their diseases present different, their life experiences, the things that they take in, um, all of those things are different. And so I really try to look at each person holistically and treat them as an individual and come up with the best plan for them. So the gut, we're going to come back to that chewing the food. We're going to come back to that at the end. But for right now, the gut, we're talking about the food that you take in. It goes down your esophagus, goes into your stomach, into your intestines, and then out the other end at some point. What does a healthy gut look like, right? So we want to talk a little bit about what it is when it's unhealthy or leaky, which is a really common term that we see in the literature and also in popular culture. But what does it mean to have a healthy gut?
Well, one, if you're having gas and bloating, that's not a healthy gut. If you're having constipation or diarrhea, that's not a healthy gut. If your stomach bloats after you eat, that's not a healthy gut. So those are, and even other things. You can have skin issues because you have a bidirectional system, so you can have skin issues. And one of the biggest things with autoimmunity is gut health. So when you look at the small intestines, they actually measure zonulin, which is a marker that just looks at how healthy your gut is. So you can actually measure the tight juncture in how healthy that is. And then you have these cells that line the small intestines, and we have a gazillion of them. My Sunday school, one of my Sunday school students told me gazillion, so that's a word, okay? So that just means you have a lot of them. And in the small intestines, they're the enterocytes. And I think it's fascinating because in the brain, they're the gliocytes, right? But they're almost identical in their in their pathology. So I think it's pretty interesting there. But if you have a leaky gut, you got a leaky brain. So the gut, so with with the enterocytes, their job is basically to take the food that you eat. When it's dumped from the stomach, it should be this thick substance, and I always tell patients it should be like peanut butter. Crunchy is partly digested, creamy is fully digested. Well, if your small intestines doesn't have all the things that it needs to break it down, then it causes damages to the gut lining and the mucosal lining or the skin of the gut. And so therefore now you invite inflammation in. And that's where a lot of inflammation starts. We do this every day.
All day.
All day long, right?
Eating.
So that's how inflammation gets in. And the food that we consume now is not the food we consumed when I was a kid.
Okay.
We have all the dyes, the GMOs, and, bioengineered, all these things. I went to Whole Foods the other day and actually took a picture. They had bread, and it was like bioengineered material in bread that they bake in Whole Foods. We're not talking about processed bread. We're talking about the bread that's baked every day. And, you have to take all that into consideration.
Right.
And then our gastric acid, as we get older, we start to lose that. So the food, if it's not broken down in the stomach, then sometimes your leaky gut can come from just not having enough gastric acid. And most autoimmune patients have some type of, we call that aclohydria or hypoclohydria. Basically, what that means, you don't have enough gastric acid in the stomach to break the food down, or you have little. And so I always tell my patients, I give you a digestive enzyme to be your aided Pac-Man so it can chomp up the food. So now it can break it down, and so your body can assimilate, and now you can get those nutrients. And so then if you can't get the nutrients from the food that you're consuming, then how is your brain going to get everything, your B vitamins and everything? And unless you take it, if you can be eating well,
Yeah.
but is it assimilating, and is it getting to where it needs to go so the bloodstream can take it elsewhere?
Yeah. So you said so much, in that, and so much information there for people to, no pun intended, digest, right? So, it sounds like there are these junctions. So similar to the brain, I talk to people a lot about the blood-brain barrier, which is basically a kind of a gatekeeper, so to speak, that keeps some of the stuff from the blood from getting into the brain, because everything that's in your blood does not need to be in your brain. And so when that barrier is broken or that barrier is damaged, it allows things to cross over that can cause inflammation. And so a similar process is also happening in the gut. In a lot of our literature, we talk about how the gut educates the immune system, and how potentially with MS, maybe there are things that we're taking in that are causing inflammation, or maybe we're not digesting properly for some reason. That milieu or that collection of molecules in our gut is not properly balanced, and that inflammation can then trigger inflammation in other parts of the body, potentially in the brain, which can cause demyelination like multiple sclerosis. So we talked a little bit about the healthy gut, right? You should be going on a regular basis. You shouldn't be gassy all the time. You shouldn't be having those issues if your gut is healthy. We talked a little bit about the leaky gut, with inflammation. And so what is the connection that we know of between the gut and autoimmunity, right? So specifically, we know that there's a link between the gut and MS, but what about autoimmune disease in general? So there's a lot of discussion and research focused on how the gut can lead to autoimmune conditions, and tell us about that connection.
It's almost the same pathway. It's that inflammation, and that inflammation is triggered. And so and I'm going to date myself on this. It's like when something hits the bloodstream, or when your alarm goes off, that alarm is to alarm you that something is happening. So inflammation within itself isn't bad, because that's our cell danger response. But what happens when it keeps going and it keeps going and it keeps going, and then now you're destroying the tissue. And when you start to destroy the gut tissue, then it goes and you destroy all the other tissue. So if your brain is the weakest, then that's going to, it's going to be more effective. I see it's almost like a snowball, right? Or avalanche. It starts with a small snowball, and as it continues to grow and grow and grow, then it becomes destructive. And that's the same thing with our inflammation. If inflammation over time becomes very destructive to the tissue, and that leads to disease. And a lot of times your stress is like, I think we underestimate stress.
Absolutely.
And I'll say this especially in our community. We think we have that superwoman syndrome. Because we don't feel agitated and stressed, because when we went to school, microaggressions were there. If it wasn't, even if you do HBU school, you went to Morehouse, you still had to go do your rotations in other places, and you were black, right? And so those things are still there that I think we don't even dive into, or, as a working mother and having children, those things are stressful, but we just plow through it. And, it's just amazing work that you're doing. And just to see the women just like get the aha. And I just love working with you. And it's just, because I think it's interesting that now we're starting to connect. When I first started this, everything was so separate, like, oh no, we don't want anything to do with you. But now we're starting to see that is the connection. And with MS, it's just, which I think my daughter probably is barking up on, but, it's a lot of has to do with the gut.
Yeah, so listen, we could do a whole episode about stress, honey. I can do about 4 or 5 episodes about stress. But I think, what you're saying is spot on. We do underestimate the effects of psychosocial stress on our bodies. And so I often tell people, my patients, tell someone else. So pretend like someone else is telling you their story, but it's your story. How would you respond? So when we are going through things, whether it's the stress of working and trying to manage children or trying to manage a job, plus symptoms from a chronic illness or a new diagnosis. I said, girl, if somebody walked up to you and said, I was minding my business and then all of a sudden I couldn't move my leg and now it's weak, but I'm not back to normal and I don't know what's going to happen. And the doctor is talking to me about these scary medicines and then they're telling me I need to do this and all that. I said, you would probably say to that person, oh my God, how are you coping? But when it's us, we say, oh, no problem, like it's not supposed to affect us. So I have this really cool sign in my office now that says it's okay to leave your super cape at the door.
I like
Because
that.
I think it's so important for people to recognize those effects and how they affect their body and how they affect their health over time. So thinking about leaky gut, let's talk about the gut microbiome, right? So I go to a lot of meetings and we talk about this microbiome. It's all of the organisms, all the bacteria. So just like all inflammation is not bad, all bacteria is not bad. You need bacteria and other organisms in your gut to help you with digestion and eliminating things. But what is the microbiome and how does it affect disease?
Well, it we have over 38 trillion different bacteria in our gut.
Now
But only,
that's a real number. So
yeah,
gazillion was too, but yeah,
trillion is a
for
real
the
number.
people in the
Yeah.
back, that's the real number.
Yes, that's a real number. But anywhere you have a bunch of bacteria, your skin has a microbiome. Your scalp has a microbiome. Everywhere part that there's bacteria, you can have a microbiome.
Mm-hmm.
And that microbiome is just basically where you have all the bacteria, but you have the commensal bacteria. So it's almost like you ever gone on a trip and you have your kids
Mm-hmm.
and you want the kids to behave, right? So if they're not behaving, we have staph already on our skin. But
Mm-hmm.
it doesn't become problematic until there's an overgrowth or an undergrowth.
Mm-hmm.
So everybody wants to be created equal and everybody's doing their own job. Then that's where it's a friendly environment or ecosystem. And now we can flourish and grow. And then you need the prebiotics to help stimulate the bacteria. So it's almost like and those prebiotic foods like garlic, artichokes, different things can help the gut. The gut's like a garden.
Mm-hmm.
That's the best way to have it is the garden, and the dirt is there. So you want that ecosystem to be friendly, so you can eliminate those things and
Yeah.
also have your immune system because 75 to 85% of your immune system is stored in the gut.
Mm.
75 to 85% of your neurotransmitters are stored in the gut. So your norepinephrine, your epinephrine, your serotonin. So a lot of times when we just work on gut health,
Mm-hmm.
then you can also work on the brain health. And I know you know this, but they're doing psychobiotics. So probiotics that are specified for just neurological disorders that will help cross the blood-brain barrier and help, our brain. Um, I did some training at the Amen Center, and one of the things that was saying that we look at our heart, you look at the scan, you look at all that, but a lot of our DSM, the coding for a lot of um, psychological disorders, they're they're by an algorithm, you know, they're just by a checklist. Like if you check
Mm-hmm.
off of this, then you have bipolar, you have that. But it's interesting how that when you really get into the gut microbiome and the brain microbiome, it's interesting in looking at the different scans and the SPECT scans. Now, do you do SPECT scans at all, or do you recommend them?
Yeah, so we don't do a lot of SPECT scans. So for our audience, those are specific MRIs that can tell us about brain function in different areas. There's lots of different advanced MRI techniques. So we do not do those. Oftentimes our academic centers do those. I don't order those on a regular basis because sometimes I have my patients,
Expensive.
they are expensive and my patients don't want to get their regular MRI. So if I add another MRI on top of that, they're really going to be mad at me. But there certainly is a lot of interesting research about how we're learning about brain function with different types of advanced MRI technology. And a lot of what you said about the gut and the microbiome is very fascinating to me. So this was not really something that we talked about in the MS space frequently until maybe the past decade or so. So the research has been there. There have always been people interested in it, but it's really become a hot topic. And I remember the first time it came to my attention was close to 10 years ago. I saw a poster at a meeting and it was talking about the gut microbiome. And so when we talk about researching MS, certainly we research MS in our patient populations, but most research starts in animals. And so there were some animal studies where they remove the gut microbiome, and the animals could not get MS. But when they reintroduced the microbiome that was similar to someone with MS, then they could develop MS. And so I was like, oh my God, so there's something to this. So I think there's still a lot that we need to discover about how the gut and what balance or imbalance of bacteria or other organisms can be related to someone developing MS, or even how can it be related to the severity of someone's MS. We haven't even gotten into that. We're
Yeah.
just trying to, there's a lot of exciting research that's being done, and I'm really encouraged by that. So when we're thinking about, okay, we know that there may be imbalance in the gut. We know that there may be leaky gut. Oftentimes, when someone is in a neurologic evaluation, I can't test for zonulin and all these other things because I'm trying to test for what's going on with your brain. But where do you start, right? So, okay, let's just assume that most people with autoimmune disease have some imbalance in their gut. Where do you start with how to begin to rehabilitate or repair?
I start very simple. So, very lifestyle modifications. Mindset is key, and people understanding, what they're going through. And like you said, embrace it. Like the leave your cape at the door. Like embrace it. It's okay if you cry about it. That's fine.
Mm-hmm.
But the other thing I start with changing their diet.
Mm-hmm.
Gluten, it has been studies and shown that it's very neuroinflammatory. There's a test we can check. It's called the Neurozoomer, and it actually looks at how gluten affects various parts of whether it's the brain, whether it's your heart, whatever, there's different markers that you can look to see what is it affecting. And so when you show people this, they're like, oh my God, I'm going to stop eating gluten. And that's, anything with bread, gluten is everywhere. Gluten is almost like you can't almost get away from it.
Mm-hmm.
And so, but the main thing is like the bread, the cereals, different things of that nature, the cookies, the cakes, and all of that.
All the good stuff. Oh
All the good
gosh.
stuff. Yeah.
Woo!
Now when I got into this 15 plus years ago, you know, it was like that, Rapper's Delight, the chicken tastes like wood, so the
Mm.
gluten-free food tastes like wood. But
Gotten better.
now
It's gotten better. It's gotten better.
a lot better. It's
Yeah.
a lot better.
Yeah, it's gotten a lot
And
better.
but even now we're
But let's back up before we start with the diet. Who do they need to collaborate with, right? So when we think about the care team, I obviously always tell my patients, you are the most important part of your healthcare team, but we always collaborate with other specialists to help us to deal with these issues. So you're seeing the neurologist, you may have other specialists depending on the symptoms. So who do you go to? Do you need a functional medicine doctor, an integrative medicine doctor, a naturopath? Who does this type of assessment and helps to develop this specified plan?
You can start with a functional nutritionist as well.
Mm-hmm.
If they are up on it, but they cannot order so many of the tests and different things like that, so they have limitations.
Mm-hmm.
Functional medicine practitioner,
Mm-hmm.
And I always send patients through the Institute of Functional Medicine.
Mm-hmm.
There's A4M is another place you can go,
Mm-hmm.
School of Applied Functional Medicine, because again, when I started, there was like 3 or 4 different institutes that was teaching. Now you can go and get go to a weekend course and come out and you can be a certified functional practitioner. So
Mm-hmm.
there's no regulatory things in that. So you really need to do your due diligence, because
Mm-hmm.
some people will go in, you'll have $10,000 worth of tests and you'll get all of this, and I see it all the time. People come to me, they've spent their money, and by the time they get to me, they don't have any money else to spend
Right.
because somebody else has hoodwinked them because they said they were doing functional medicine. So I would strongly recommend, before you spend any money, do your due diligence, make sure the person is is what they say they are, and read some of the reviews. Let the reviews speak for themselves. You can tell whether a review is paid for or
Mm-hmm.
whether it's genuine. But
Mm-hmm.
especially through the Institute of Functional Medicine is a great place. Lifestyle medicine now is crossing over and training a lot of MDs and DOs and PAs and nurse practitioner, and just identifying lifestyle factors that impact our health
Yeah.
that we did not learn in traditional um,
Not a lick.
medical school.
Nutrition was 2 weeks, and I don't remember anything except phytonutrients, and I don't know that I remember what those are.
Yes. So that's who I would add to the team, and
I love
also
it.
get a a family member, bring somebody with you.
Yes.
4 years are better than 2.
Mm-hmm.
When you get a diagnosis, you just, after you get the diagnosis, you forget anything else, right? You're just sitting there, you're in the twilight zone, and you're deer in headlights, And I can remember my mom was diagnosed with cancer. We were sitting there like, what, So you having a good care team and making sure that people are talking to each other,
Yeah.
and keep your own notes. Ask for a copy of your notes. Take it
Mm-hmm.
with you. Ask for a copy of your test. Be your own advocate.
Absolutely. Yeah, I always educate my patients and say, you are your own best advocate. All the things you're saying are spot on. So, for anybody that's watching that's seen me, I keep saying, bring somebody with you, take notes, prepare for your visit. What are your questions before you get there? So that that person doesn't walk out the door and that burning question that you had doesn't get answered until you have to go through the patient portal, or you try to call them back after they already seeing somebody else. Make sure you have your own agenda, because each healthcare provider will have their agenda. We have the things that we want to cover, the things that we need to get through, but you need to have your own agenda when you go to those visits so that it can be productive for you as well as productive for the person that you're seeing. So we said lifestyle medicine, we said functional medicine. I love that you pointed to that caution to do your research. That's something that we also encourage our Brain Chat audience to do. Some things that I've seen, from a traditional standpoint, is certainly, when we talk about traditional medicine, I do believe there's a place for traditional medications. I went to medical school. I do not believe that traditional medicines or pills are the answer to everything. I believe that lifestyle has a lot to do with our health. However, I've seen some people who've gone the opposite route, where they have seen someone either in a functional or other field of medicine outside of their neurologist, and then they come back to me with 20 pill bottles of supplements, right? And so I'm like, well, honey, you take one pill for your MS and you got 30 pills over here, right? So I think, again, striking that balance, right? Finding the right practitioner, the right person that connects with you and that can help you with that individualized plan is so important. So you need to start with someone within functional lifestyle medicine. Talk about what are the lifestyle interventions, accept the diagnosis. And then in terms of diet, what about that? So where do they start with diet? So you talked a little bit about testing to see if there's gluten sensitivity or issues like that. Is there anywhere else that people can, start or go for good information to learn about their diet? They ask me all the time, Dr. Missy, what should I be eating? What's anti-inflammatory? What should I be taking? And I say, I'm going to give you somebody's number right here, and then we're going to work together with them, to make sure that we have the right plan. But, people often want to know where to go for good, solid information.
Yes. And like I said, it's just finding a practitioner because there's so many variations on the elimination diet. And they said that's key. And you have AIP diet, and that's but even my patients that listen to every podcast that's out there, when they get to me, like, this AIP said I can have this AIP said I can have that, and you can't. And again, there's no two people that are exactly alike.
Right.
Some people will be so focused on getting food sensitivity tests because they want to know what that is. And I said, well, the food sensitivity test is a tool. However, you have to take the person, the history, and what's going on, because if your immune system is in a flare and you take a food sensitivity test, you could have false positives and come up with everything. I remember the first time I did mine, I thought I was going to have to go see a therapist. I'm like, oh my God, what am I going to eat? Grass?
Can't eat anything.
And I'm like, yeah. But the aha moment for me was when I could have scallions, but not onions. They're the same thing. So that is, if your gut is so inflamed, you can react to a lot of things. So it's the practitioner knowing how to interpret the test based on your history. If this is something you eat all the time, then maybe it's too much. Maybe you need to pull back.
Right.
It doesn't mean that you take it totally out of your diet, right? Or I say your nutrition, because I hate the word diet. Because
it implies you're trying to be on a diet, but it's really, that's not what we're talking about. We're talking about what you eat.
Lifestyle, yeah.
Yeah, your lifestyle, the foods that you take in.
Because even the word diet, you think of when am I going to start and when I'm going to end.
Right.
When it's lifestyle nutrition, I mean, it's a long life thing. And you got to have ebbs and flows, right? And I tell people, are you going to eat gluten-free the rest of your life and you have an autoimmune? I hear some people say, oh, you should do that. Honestly, enjoy your life. If you have anniversary, birthday, I have an 80-20 rule. But the thing, knowledge is key. So when I know if I eat that piece of bread and I can't get out the bed the next morning, that's on me.
Right.
That's not on Dr. Mitzi.
Right.
That's not on Dr. Sanza.
Right.
That's on you. And you have it. I remember on Fridays I would go through and not have lunch, and I'd go home and my husband would have pizza there, and I'm like, I'm gonna eat this piece of pizza. I don't care. You come stab you like with Miss Ford.
Right.
But then I pay for it, and then I won't eat it for another year.
Right.
But you know what I mean.
Right.
So
Right.
but I knew the answer. So knowing your body is one thing. Listening to your body. Our body is constantly speaking to us.
It is.
But do we really listen?
There's that.
We chatter it out.
And that's the difficult part, right? Is that our bodies are often telling us, and going back to what you were talking about with the elimination diet, I'm sure there are many different variations, but, we've had other functional medicine and integrative medicine, practitioners on the show, and we've talked about elimination, right? So you take away one thing, you see how you feel, and then you reintroduce it, and if that gas came back after you
Then
start,
that's not your friend.
right? That's not for you.
Yeah.
You know what I mean? Or if you want to do it, then you know the consequences. So it's so important to listen to your body, and to be patient, right? We've had different things that we've been, taught to eat, things that we grew up eating, things that we think are healthy that may not be as healthy as we think. And so the process is not going to be overnight. And so when people ask me what kind of diet should I have, I'm like, the one you can keep up with. That's the best one for you, right? So don't go do something drastic and cut everything out, and then you just hate food and it tastes like plastic to you. But let's find that happy medium. Let's get some assistance from someone with expertise, and then let's kind of craft that plan and, baby step it, so that we can make changes for a lifetime and not just make changes for a temporary period of time, and then it all blows up because we can't keep up with that drastic change that we've made. So
I normally start with gluten, dairy, and added sugar. Those are my three. Hence 3D wellness, mind, body, and spirit. I work in threes.
Yeah.
And it takes a minimum of 21 days to turn over new gut flora. So do that for 21 days, and like you said, start adding things back in. And then or at the end of 21 day or 30 days, I've extended to 30 days, but at the end of 30 days, now we can see food sensitivity, because now we have a better foundation and we can see what's going on. And I tell you, most of the time in that 30 days, people will come back and say, I'm sleeping better. I'm going to the restroom now on a regular basis, because that's another thing. If you're not going to the bathroom, and I mean number two, all those things are circulating, whether it's estrogen, toxins, or keep going, and you keep those in your body. So just simple things like making sure you're going to go poop, making sure you're staying hydrated. The solution to pollution is dilution. So if you're not drinking,
Oh, I'm going to steal that. I'll give you credit the first time, and then I'm going to steal it.
well, I stole it from somebody, so you can have it.
Well, thank you.
Okay.
Thoroughly grabbed. I'm sorry, I didn't mean to cut you off.
That's
You were
okay.
saying the solution is diluting. So make sure you're drinking water. Right.
And not coffee. People, I drink coffee, I drink tea. No, go back
Coke
to
is not
water.
water. Sprite
Water.
is not water. Those things are not water. Okay.
H to
Are
the
water.
2 to the O.
Exactly. No
Okay.
additive, just water. Yeah, so this has been an amazing discussion. So, who knew that I would be excited about the gut? But there's just so much to learn. And in my quest for knowledge, I always love to have smart people who are doing this work come on and, chat with our guests and just give us some insight into what we need to be thinking about, where to go to get help. We always want our patients to be empowered, and we want our community, our broader community, to know, where do you get this expertise, since we didn't get it in medical school or nursing school or all the schools. So I really appreciate you taking your time to come and talk to our Brain Chat audience. What words of wisdom would you give for someone who is like, okay, I've got an autoimmune disease, I'm just getting diagnosed, I want to live a healthy lifestyle. What advice would you give them to start out on their journey?
First, just stop and take a deep breath. Okay? You are not your disease. I think a lot of times people walk in, I have MS. You don't have MS. MS is manifesting in your body, and how do I get rid of it? And finding the right person to work with. And I work with, if your team is not aligned, works together, your neurologist should not be against your functional medicine doctor. Your nutritionist should not be against each other. They should be as a puzzle, and they should align and work together and be a unified. You are the CEO of your health.
That's
And
right.
when you take control of that, then that's the first healing. And working with a provider that you feel comfortable with, because that is the first line of healing. And I know Dr. Mitzi patients, I just love her, but that's the first part, because they feel that they can relax. They feel that they're not going to be judged, and they're not going to be looked at a different way. So that is, I think that is the biggest thing that we don't, that we need to take in consideration, is when you're finding that practitioner, find that right one for you. You are hiring them. Your insurance is paying them, and they're working for you as you're working, so you just need to find the right person to work with, and also listen to your body. And people say, I noticed something different when I was eating nuts. I was like, stop eating the nuts then.
Right.
You don't need Dr. Mitzi to tell you to stop eating the
Right.
nuts. You don't need me to tell you to stop eating the nuts. Your
Exactly.
body is telling you to
Your
stop
body
eating
is
the
telling
nuts,
you.
right?
Absolutely.
And having conversation with your family, because a lot of times when you're starting to make these changes, the family doesn't want to make those changes, right? And understanding, like, this is what mom or your sister or somebody needs to be healthy. I think I'm like you. I do more lifestyle teaching, and it's like, okay, let's just make it make sense.
Yes.
Make it make sense to you. And I'll never forget, what do we do with collard greens? We kill them. We put them in the pot and we kill them,
Girl,
right?
we kill every bit of nutrient, we turn them into mush.
Yes. However, all the nutrients doesn't go away. Everybody's doing bone broth, but we've been doing pot liquor for a long time. So all the nutrients in the pot look up, but we throw that away, right?
Right.
So eating, learning how to eat sauteed, where you don't kill them all the time, getting those nutrients from your food, and really enjoying your food, having your food sit before you in rainbow. If your food is gray and white and you're just chicken, you need to have different color foods, those phytonutrients. It's going to feed your gut, going to feed your brain, and you're going to feel much better. So when you look at your plate, if your plate doesn't have the color of the rainbows, then throw something in there. So those are just, and walk, getting some exercise, movement. I hate the word exercise too, is movement therapy.
Yeah.
Whatever you like to do with movement. Sleep, key. That's when your body revitalizes itself. God has designed that to heal. So you can do all the things. And if you're not doing sleep, if you're not getting about at least 7 hours,
Right.
that may be stretching it. I would like more, but if you can get 7 hours, that's going to help heal your body, get into that healing portion of it. And then stress. Sometimes you just got to do it for you. That's my new motto for 2025. Do it for you.
I love it. I love it. I love it. Well, that is all amazing advice that our audience absolutely needs, for those who are living with MS and those who are not. Everybody needs that advice. So tell the people where to find you, Dr. Sanza.
Yes. My website is 3D Wellness, and the 3 is spelled out. And I hate to be, it's THREE, in case if y'all, need little what 3D Wellness.
Say it for the people
Also, also Instagram is 3D Wellness underscore GA. And Facebook is 3D Wellness. We also offer discovery calls. So if you swipe not on the fence and you want to know am I in the right place, or you just want to know more about the practice, we're going to start doing discovery sessions. We were doing discovery calls, but we're going to maximize our time and work smarter, not harder. So we're doing discovery sessions, so you can jump online and learn more what we do. And I'm honest with you. We'll tell you whether we can help you or not, or if there's somebody in your area that can help you. I'm an advocate for you, and I help people. People come into my life for a reason, and I don't want people in a season. So I want them, if it's for a season and it's just for me to tell you how to get to Dr. Mitzi, then that's it. That's fine too. I don't have to be a part, an initial part, but I'm a part because of the collaboration.
I love it. Well, thank you so much, Dr. Sanza, and thank you to our sponsor, the National MS Society. And we will see you guys on Brain Chat in 2 weeks. Have a great one, everybody. All right.
Thank
Thanks,
you.
Dr. Sanza.
Bye-bye.